Hello and welcome back to my channel. My name is Adama Cisse. This is Earth to Adama, and this is another part of my fibroid journey. So I am now about almost a month, like a few weeks post surgery. My surgery was on June 5th, and today I'm filming this on June 25th. So it's about 20 days. And I had a laparascopic myomectomy. If you watched my earlier videos, if you have not yet, go check them out because it gives you more background to what I'm going to talk about today. But I am feeling so much better. I mean, it needed to happen, it needed to be done. The one fibroid that I had was so big. It was about 8 by 10 centimeters. And the others were small, but that one was giving the most issues and affecting my quality of life. So I really had to get them out. And I know it's like, yeah, I could have maybe gone a holistic way, but it was really challenging for my quality of life. I wanted to really get them out. And this was the biggest recommendation from my doctor. And so I'm feeling great. My incisions are actually healing pretty well. They basically went in. So let me stand up. And you can see here compared to like my pictures as well. Like my midsection is so much flatter now because I don't have a freaking fake baby bump, which is basically a fibroid. But basically, the incisions were one was down here through belly button, and then there were two small incisions here. And she did a great job stitching them up. She did a great job, like making them really not noticeable in great places. So I really loved my surgeon. And I went to Dr. Lee Rosen at Mount Sinai, New York City. And even though I'm based in Miami as well, I opted to go back to New York for my healthcare because, for a lot of reasons, okay, women's right to choose, okay, what they want to do with their bodies. But also, it's just a better medical system, and Mount Sinai is a way better hospital than U Miami. So check out my old videos. I talk a little bit more about why I chose to travel for my surgery. But I'm feeling so much better. It's like it was challenging, as you all saw in those past videos, getting through the after part of the surgery up until I would say the 5th day. So that was when I made the trip back down to Miami. I I still needed a wheelchair to get to the gate and everything. And like we got extra comfort seats, because just needed more room, and I had Freddie, my dog, with me. So the trip back I wasn't feeling horrible, but it was still like I had to be careful. I was still on pain medication, and I still had to be resting and not lifting heavy things. And then as I got back down, the 6th day, the 7th day, things started to progressively get better until my post op. So I actually went back to New York City on June 18th for my post op appointment. And there it was like she was talking about, she took a look at the incisions, made sure everything was healing up all right. She asked me how I was feeling. We talked about what to kind of do now at this point. But at the same time, like doctors don't give you real holistic advice. Like they take them out for you, they'll give you medication, they'll do hormone infusions, things like that, but they don't really give you the true how should I change my lifestyle to really prevent getting more of these. So I went to her. She didn't really give me tips on that, but basically she was just like, you should feel a lot better now. And I really do. It's like it's not only like my stomach's smaller. I've lost 10 pounds, which obviously it's not weight. It's taking out tumors out of my uterus that don't belong and are weighing me down. And then like I just feel less bloated. My period as well. It was like a few days before my post-op appointment, and it was actually a breeze. I was not the same cramping and just feeling awful and like heavy periods. I didn't have all of that. It was actually the easiest period I've had in years. So, and that was after the surgery. So already I'm like, it was worth it. It was worth it. And I'm so glad I could get a laparascopic myomectomy because the downtime for this is about 2 weeks, really a month. Like, so I can do everything basically normally right now. I'm back pretty much. I'm feeling 100%, but I have to wait until like a month after. So after July 5th to work out again. So I haven't been working out. I've just really still been taking it easy until that date. With best believe I'm going to be back in the gym. But another thing that I've really started to do was clean up my diet and really research, reading books, seeking real advice from nutritionists and integrative medicine doctors, and just I'm still kind of searching for someone to really help me one on one. So if you're in that field, let me know. But I really want to take a holistic approach now at this point, because if you have the propensity to get fibroids, you shouldn't just go back to what you were doing before and having the dairy, having the red meat, having the alcohol, having the caffeine, and think that, okay, you got it removed and now you can just go back to acting and eating and doing whatever you want. And it's not the case. So I really want to take that approach now. I've gotten this procedure. Now it's time to really nurture and take care of my body, my womb, to make sure that these suckers, they're not coming back. They're not welcome here and they're not coming back. So I've really made some changes in what I'm eating and consuming over the past few weeks since my surgery. And it's a learning curve. And I'm really also again seeking a professional to really dive deep into it and really help me on a one-to-one basis. Rather than I've bought some books and, listening to some audiobooks and really looking at what I should be eating. Not only food have I changed, but I've also changed my diet, like the types of food, of course. And then clothing is really important, because there are clothing that have endocrine disruptors and hormonal disruptors that can encourage fibroid growth. And not only that, cleaning products, beauty products, things you're putting on your body, and really being mindful of the ingredients of those things. So it's a learning curve right now, but I'm really focused on how I can be more holistic at this point moving forward. And I want to do a video on that another day, kind of like where my eating's at, how I'm feeling, what beauty products I'm buying, the clothing that I'm switching to. Like, I even with my workout clothes, it's kind of horrendous when you think about it. Literally, if you have the workout, yoga pants, all that, and they're made of like polyurethane, you're literally wearing plastic on your body when you're sweating, and you're basically intaking all of that plastic, and that's affecting your hormones. And one of the correlations they found with fibroids is high levels of estrogen that your body isn't able to break down, because you're consuming a lot of these hormone disruptors, these endocrine disruptors, and that can produce uterine challenges. So I want to do a whole video on that. I'm not a medical doctor, of course, but you all know that. So these are the things that I'm doing and that are working for me, and they can change and evolve. But I really want to let you all know that I'm feeling good, and I'm really glad I got it removed. One thing my doctor said to me is, she was like, women have fibroids, like, a honestly, everyone, a lot of people have them. But the thing is your case, them getting that big, there's a smaller percentage, and Black women have a higher propensity to get bigger ones. So that's why it was just so important for me to improve my quality of life to get this surgery. So it's the laparoscopic myomectomy, check out my earlier videos for more details on what that entails. And there are so many other methods and operations and surgeries that are available for fibroids, but this is the one that I was diagnosed with because it also depends on the position of your fibroids, where they are in the uterus. It really depends on all of that in terms of what surgery that your surgeon will recommend for you. I'm going to talk more about food and clothes and all of that in other videos, but this is the end of my actual surgery journey. I think this will be the last video because it's done, it's over with. I feel good. I also am thinking about, actually not thinking, I'm going to, because I had such a great experience, switching my OBGYN care all back to Mount Sinai and back to New York. And my doctor recommended, once a year, get an ultrasound so you can kind of see where things are. You can kind of be aware. And yeah, I'm excited to also get my pap smear because I wasn't able to due to this massive fibroid blocking my cervix, which is where they take the sample for pap smears. So I'm feeling great. I'm just in shock at just the difference in my body, and like quite literally it's like night and day. And you can see there's a huge difference. And I just think it's so unbelievable. My doctor was like, the size of the fibroids, it's basically equating to a 4-month pregnancy, basically. That's why it's like they're just there. So yeah, I'm feeling grateful that I was able to get them removed. And now it's just changing the lifestyle to ensure that I am processing my estrogen and I'm really creating an environment in my body where these things are not going to come back and they're not going to grow. So, thanks for watching my fibroid journey, you guys. It's been intense, and I will see you on the next video.